Daktari Akwifan, welcome back to part 2 or the second half of this amazing episode with Dr. Jackie. You said
Mwanu.
Mwanu.
Yeah.
Jina bad kubwa.
Watu wajuangi nimetoka wapi? When you say Mwanu.
Yeah, it sounds tighter kiasi.
Ndio hiyo. I've been called tighter, Kambas, do what?
Yeah, alafu pia una telltale signs za bado wanyoba. Which is great.
Yeah.
You talk feature wise.
Kabisa.
So Daktari, you're telling us your amazing story. So umetoka is it Elbagon?
Elbagon. Nimequit.
Resign.
Nimeresign.
Yes. Cats. You know it takes a lot to actually just leave your job. Would you know that?
You're young. Hauna, responsibilities. Well, responsibilities zikosangi, but you know what I had in my head? I was like, I'm a doctor, sintapata kazi tu haraka. Haiwezi kosa. Na hii skills zote na knowledge. 2018, Feb. That's when I resigned. So after resigning, I'm here applying for jobs in my boyfriend's house.
Where?
So hiyo nimewekwa. Vile inafaa.
Umekuwa housewife. Kama ni house.
House girlfriend. Hata sijui utajiita nini. House girlfriend. So yes, I'm applying for jobs. And by God's grace, by August, nilikuwa nimepata job.
So you quit in February and
August nilikuwa nimepata job. So nilipata job, it was in a wellness clinic. And interestingly, so by the time after I quit, you remember I told you I used to be sick. Nilikuwa na hiyo chronic gastritis. Ile watu wanaitanga ulcers. Nilikuwa nashangaa nikiwa daktari shughuli nitaishi hivi for the rest of my life. Ati namezanga hiyo omeprazole daily. Ati skuli vitu tamtamu huku nje. Ati hata ile kitu kukata maji is a done deal. So hiyo nimekonda, watu wameanza kudhani niko na maugonjwa zingine. Nikajiuliza hiyo swali, I was like, it actually shocked. I was ilikuwa inanisumbua because I'm a doctor and I don't have a solution. So when I got this job, they listened, the interview was more like telling my story. That's what impressed them. I was like, okay. So because I will be more in touch with the patients.
So you more understand.
Nikapata job. The doctor I met there, she's an integrative medicine practitioner. What people know as alternative. Wacha niseme venye watu wanadhaningi. Madaktari wa herbalist ama mitishamba. Mimi sijui watu wanazijua, watu wanasemanga wanaitwa hivyo. But I met that integrative medicine practitioner. She's the one who helped me. Yes.
Do you mind telling us in wapi wellness center?
It's called Akea.
Akea.
Inaitwa Akea Health Clinic. And you know, being like she's one of the women I applaud. She's called Shanal Shah. She's Indian. She's one of the women I applaud because she helped me heal. The physical health ilipona. Within 2 years, I was back to eating.
So chronic gastritis iliisha?
Baba sana. Mimi sasa nakula.
Unakata maji?
Hapana. Paka kukata maji niliacha bana. Hiyo nayo of importance is that si unaona nakunywa maji.
Hiyo
nakunywa.
So she healed you within 2 years.
2 years.
No, you're now working for her.
Yes.
In her.
So I started. Yes.
It was her wellness center.
Yes.
She's a doctor, then she's specialized in integrative medicine.
Yes.
Which you are saying we call alternative medicine.
Yeah, ndio mnajua, but that's a tutaendelea hapo. So within 2 years, I was able to recover, from eating rice, chicken and cabbage to I could stomach, beef, maragwe. Sikuwa nakula. It was bad, sikuwa nakula. Nikaanza ku gain weight. Nilikuwa 45 kgs. Nikaanza ku gain weight. And coming joint pains, remember I used to have joint pains, zikaanza kupotea pole pole. Zinaanza exactly, I had to stop them. Once in a while ukipata a flare up, I used to take, but then it wasn't like an everyday kind of thing. Yeah. So that's how. So in the process of being in that wellness space, she inspired me. Like I was like, wait, you mean hizi vitu zi uponwa?
But tell us how. Tuambie uliponaje.
So
nini
Shanal
Shah.
Aliniganga, sikuniganga. You get to the root cause of what is actually disturbing someone. You can't. Goja. Nikataa kumaliza kitu. Sasa the other root causes, like unajua root cause, it's not just kama hiyo H. pylori. It could be an infection, it could be stress, it could be what you're exposed to. What you're exposed to ni kama environmental factors. You see, environmental factors can be, where do you stay? For example, people who live in more greenery spaces. Kama Karen, uko kunitwaje? Arboretum. Kina wewe Arboretum. Watu wenye green leafy suburbs compared to when you're living in a place where matatu ndio inakuwa mshanga. Moshi. Dustbin.
Usually I met someone who stays in CBD. That's when I met someone who stays in there.
Ebu niambie kama mse yulala. Simple thing. Hiyo makelele. And lack of proper sleep will of course affect your health. That quantity and quality will affect your health.
Root causes.
They are called root causes, yes. So when you get...
So where you stay is one of them.
Where you stay is one of them. That's an environmental factor, right? So the noise, the pollution, whether ni air, whether ni... unaona kama hizi dumping site. So kuna zile dumping sites zinagonga tu mtaani kwenyu ziko tu hapo. Wewe na ukuta yako ni dumping site. Hiyo harufu, hata kama si wewe kama adult na mtoto wako. You know the kids around there. So those are environmental factors. We have exposure to things like pesticides and herbicides. Na pia hii fertilizer. Kumbuka kuna fertilizer. And remember, you'll fertilize your maize, let's say, or spray them, your crops, whatever. Kunyeshe, fertilizer sitaingia kwa soil. Maji sinatembea. Hiyo maji inaenda wapi? You will drink that water at some point. Right? There are also the things we use on our bodies. Izo dio, sprays, perfumes, there are many things. So chronically exposing ourselves to them inakuwa pia ni shida. Kidogo kidogo, constant, makeup, hair. There's a lot that goes on.
So all those things are...
Yeah, those are lifestyle factors. Oja lifestyle factors zenye tunajua.
Mimi najua katu lifestyle. Maze piga tizi kuuza pombe wacha sigara. Full stop.
Kuna other things. See, the thing is, unaona kama dio yenye unebai. Leo nataka kupea assignment. Hiyo dio endo uangalie ingredients. Alafu ukae tu chini uangalie hizo ingredients, their impact on health. Na hizi si stories za jaba. Like it's evidence-based medicine. Because I purpose to make sure whatever I'm...
Yeah, because that would be my next question. Have we, because in medicine, from the days of biokinetic, we're being told, research was done on this number of people who used these deodorants, and their control did not use or used a separate one.
Yeah.
And they were followed up over 20 years. And the result was that the group that were exposed to these deodorants had more incidences of H. pylori as opposed to the ones who were not.
Wewe hiyo research ya dio yako umeiona wapi? Exactly.
That's my question. Now, we are saying all these risk factors, but what's backing them up?
So there's evidence. Journals. Even the common ones, BMJ, that BMJ journal. So it's a scientific journal, a medical journal. So there are different medical journals which you can read through and actually identify these things. Na vitu zingine, like for example, fluoride and thyroid patients. It's documented research,
Fluoride
na thyroid patients. So when you find that, when you withdraw, ama you reduce the usage, unapata such things. And some of these things, by me saying, kama fluoride, na easy perfumes and roll-ons, we usually apply them on very intricate areas. Karibu na your breasts, you want to apply it on your neck, next to your thyroid. We are pulsing it. So we are putting it on pulse areas. Penye inaabsorbiwa ndio inuke vizuri.
Even used to do this for sky.
When niambie kitu unaeka huko alafu itakumess. So those root causes are the ones I was doing now on the job training, sindio? So then I decided to actually go to school and study that integrative medicine.
Okay, now there's a specialty in medicine, first of all, that now this is new stuff to me.
Yes.
There's a specialty in medicine called integrative medicine specifically.
Yes. So integrative medicine combines both what people call alternative medicine and the Western medicine now, our conventional medicine.
So you do both?
Yes.
So as a doctor,
yes.
Umepiga MBCSP yako pale. Imesimama. Pathology mazee umeandika. Unajua vile sijui iodine inafanya nini. I remember those very hard
molecules,
thyroid to make the thyroglobulins and all that.
Ndio.
Umepiga hiyo, alafu unaingia pale sasa integrated medicine.
Yes.
Wanakuambia acupuncture.
Wanakuambia hizo vitu.
It's going to sort your thyroid.
Sasa
how do you transition? How do you, because me I find it hard with all that scientific knowledge behind. I find it hard to buy into these other knowledge, these other things.
I was very skeptical as well. But the moment mimi nilisaidika, I was like, wait, hold up. I need to read, learn. Because sasa yuko job and you're treating people from that wellness space. Ndio lazima usome, upende usipende. Utasoma venye Panadol ina interacting na turmeric. Na usome kuhusu hiyo turmeric like evidence wise inafanyaje kazi, you get. Utasoma venye kitu kama
turmeric ni ingredient ya jikoni.
Ndio hiyo. Turmeric, ginger, garlic.
Sasa kunywa concussion for home. Hapo bado anakuja anasema sijapona.
So now you need to know. Now that's why I usually say you need to know how you're doing things. Make sure you're doing things from an evidence-based perspective. Hii mambo ya kufanya vitu tu kuku. Alafu unajua, si kuna ile grading, like you see the way paracetamol is written, you need to take 400 milligrams, 500, 1 gram, 2 grams. There is also a flip side to the other side. For example, ukimeza turmeric na unaenda theater, turmeric chronically can cause bleeding. So if you're going to theater na umekukitwanga turmeric sana, bleeding disorder, you get.
So it's like a blood thinner?
Like if you take it too much, it can have blood thinning effects. So that's what I'm saying. Like you need to have, you need to do things with evidence.
Yeah, because what I know about mainstream, or they call it Western medicine, is that most medications that we use, most of them are from naturally occurring. But then they're in measured doses.
So even on this side, when research is done, they are put in measured doses. Kama aspirin is from white willow bark. White willow bark exists without now causing you gastritis. Yes. So you can take white willow bark in the nini of, and it works as aspirin in terms of. So now inakuanga na graded doses. Una venye tunasema there is 200 milligrams, 400 milligrams, 600 milligrams. They come in supplement form. Now that's the other thing. They can come as supplement form. They can come as powder forms, as extracts, as droppers like solutions. So they have different forms. They can come in. Yes.
Si kama zile wa Masai mazee anakupea 20 liters. Tunakwambia drink 10 every.
We hiyo kwanza imekuja na story. Hiyo nayo ilikuwa na anyway. Hapana, kidogo we've had a conference in integrative medicine. There was a conference last year in integrative medicine. Anyway, Cambry tells us that unaona hizo mitungi zingine zinakuanga na augmentin nini, si utapona, si kuna augmentin.
Wait, hizo mitungi zao wameka augmentin? Ameenda akabaito the regular augmentin akakwekea.
Si anafungwa tufunganga hizo capsules. Inatingishwa kama ile ya supu.
Alafu anakupea.
Yes. Aren't you going to feel better?
You are.
Yes. Because ina target microbes 1, 2, 3, 4, 5 here and there.
So anakupea hiyo hapa.
Masai imenisort. So
conference Cambry.
Yes. So si ndio Cambry walikuwa wanatuambia sasa hiyo story because we realized they go now to mashinani areas, to deal with these traditional practitioners, just to see what exactly are they doing, because now them they can exactly, because mkifanya research some ina allow for regulation and policies. Wanapata vitu kaizo.
Maybe is it not could be a naturally occurring augmentin.
Sasa imetolewa sasa tushe
it could be,
but walipima sasa hizo dosi zenye wanapata huko ndani ndio unapata maybe iko na mimea kama hii iko na augmentin ndani,
kuna mimea tu na
kama mmea kuna so these things do work. So when I look at my patients naangalia from both perspectives. So umekuja, you know, all chronic diseases, diabetes, hypertension, thyroid na nini ziko na root cause. And you asked a very important question, ati ai kwani unaamini aje hizo vitu bana? Like unajua venye tumefundishwa, you don't. It's because I got better. And number 2, it got me questioning myself. Why do I always, like a patient will pop into the clinic na nimpe painkiller jono mwana kichwa. Wewe unajua venye si prescribe dawa. Uko hapa pale hata uone sura ya patient. Ati unamwona kichwa Panadol. Go. Ati joints zinauma, meloxicam. Yes, you don't even know the face of the patient. And the side effects that come with chronic disease over time, like the complications, I mean, and also the medication side effects at times.
So now in this integrated medicine, you targeting a patient specifically.
Yes.
Kama yeye.
Yes.
So amekuja akona type 2 DM.
Perfect. So your care is holistic,
so
all-rounded.
Let's run a case. Okay. Nowadays you see these things in very young people. 40-year-old. Is akona mwili yake msio mbaya. BMI hata si mbaya 30. Okay? Amekuja ni hypertensive. Not even so bad. BP 150 over 99. Okay? Start.
So akikuja
mpate HbA1c iko juu kidogo.
So when they come, we do a thorough history. And by thorough, I mean, it takes me almost 45 minutes to 1 hour.
Just
taking a history. Because history yako ni kutoka as far back as you can remember as an adult. So from your birth history all the way till when you get sick. And it incorporates the things I was telling you. Where do you stay? How's your work? What do you do?
What do you do?
All those things. I ask as much information as I can get from you. I ask. Your relationships. Kiboma. Unaweza kuwa mnapigana hapa vita kila siku ndio maana pressure yako inapanda. Si nilisikia you didn't hear that quote ati when men get married. Anaitwaje when men get married. That's when they start developing chronic diseases.
Mimi naona tishwa sana they eating because the wife is always experimenting in the kitchen.
Ndio. So umepata patient umechukua the whole history, right? And you're taking it from that holistic perspective. Like you're not just
Zile, unajua tuko na make fun of these histories. I remember Dr. Joe telling us to ask what form of fuel
right?
they use. Is the house ventilated or not? And you're like, sasa hiyo.
Ina relate aje. Wewe bana pass to exam wewe.
So you ask all that.
So you ask all that. And then after doing all that,
so I'm getting family social history is very important.
Extremely important. And now you una incorporate sasa hizo vitu zingine ulizi. Water intake, you know, when you're doing your diet, nataka uniambie unakulanga nini breakfast, lunch, dinner, like you give me an estimate of almost like 3 days in your week. So that I can have a rough estimate. Maji unakunywanga kiasi gani, pombe kiasi gani na nini. Hizo vitu tulikuwa tunauliza. Smoking kama unatumia na nini, unaishi wapi, you know. Oh, you stopped. You need to continue asking.
You smoke, no.
Kidogo alafu unajua kwanza sahi sio kusmoke tu cigarettes, kuzi vitu zingine zinavutwa.
Wanasema hata wana vape and that's not smoking.
Apparently. So you ask that story in depth, then you now do your investigations. So they can come in with investigations or not. So we'll do our investigations. They could be on medication or not. And patients have become woke. Let me tell you. They walk in and they're already telling you, no, doc, you know, I've been trying to use my diet to change a few things. I've been trying to take turmeric, like a whole glass. Like they've been trying one thing or another. If our medicines come from plants, why not use our diet to help our patients?
What? By the way.
So if you can be able to use that, na unaona prevalence ya chronic diseases venye imetamba. Sahi hadi watoto wetu wako na obesity jamani. Sasa unapata hiyo history. Unaweza pata kama huyo mzee yako 40, yeye na mtoto wake wanakuwa tu mapizza. You know, they are eating. Na unajua mtoi wako atakopi kenye unafanya. Mbona asikopi? Kidogo kidogo unasema ni genetic. And ina arise too from what you've been doing in the house. Anakopi tu. Then you're saying in our family we have diabetes, in our family we have hypertension. Kidogo in your family you just eat badly. Unakunywa, you know there are things that happen, and then you say, this one, diabetes is in our family.
It's a family habit, not a genetic thing.
So amekuja, tumefanya tests, then we come up with an individualized treatment plan. So unaweza kuwa huyo mzai mwenye ako 40 na wewe pia uko na the same diabetes, but your root causes are different. Maybe this guy works in a very stressful environment, he lives where hakulangi ama anakula venye anataka, or he's constantly on soda, there's that. But we also recognize that there is the genetic predisposition ile around. Yeah. So that one we recognize. But at the same time, we come up with that individualized treatment plan. So incorporate.
This individualized treatment plan for this our area is diagnosed the aim at 60 years.
Yes.
It's not involving medication.
So it depends. Right? It depends. Kama mtu akona sukari ya 35, surely 33. Unataka kuambia mzee tu ende ukule matawi 1 2 3 alafu itashuka? No, because you need to also have followed up that patient long enough to know how is their compliance. Unajua niambia mtu aende tu home hivi, akolapsia kwa barabara. Niliambia nikule turmeric. So you'll have to assess, where were those sugars at? How long has this been disturbing you? Are you already on medication or not?
So are we aiming, because I know in more Western medicine, for chronic diseases, we are not really aiming for cure. The diabetes, like actually the Dipona diabetes. I once had a patient tell me that in Dipona, I was like, okay. Yeah, because we know that, these are meant to control this. With this integrated medicine, are we aiming for cure?
One, if you can be able to reduce dawa zenye peremende zenye unameza, mimi zita peremende. Because unajua saa zingine pia si madaktari tunakuwa na mchezo, mimi husema hivyo because mimi unieke, unaona kale kakilo ka pill count. Monday, Tuesday, Wednesday, Friday niko na peremende 5. Hata mimi mwenyewe. It's a problem, right? So we are aiming, one, una reduce pill burden yako as much as possible. There are guys who've been able to reduce their medication. Some have gone off of it. Some have not even started. Like unakuja na sukari ya 15, bana, hapana. Let's deal with it first. Yeah? Because there are emergencies. You don't want the comas and what have you, right? And una make sure follow through the patient, you're looking for that compliance consistency. Because diet and lifestyle, I usually say it's one of the hardest things. And it's a lifestyle choice. Yeah. So something you've been told, are you willing to do it? Ama ni daktari amesema. Kama ni unafanya juu daktari amesema, that mentality we slowly work on it. Because if you're doing it, juu uliambiwa na gym instructor uinue weights, hata ujui kwa nini unainua weights. And you're explaining these conditions to the patients, pole pole ndio waelewe. So this treatment is holistic, it's individualized, it's patient-centered.
Now I'm getting, you really have to work on the mentality of these patients.
As I said, ni kazi.
My weakness. For example, mimi, mtu akiweza kuja niambia, tuashane na Coca-Cola baridi. Tumekosana. Coca-Cola? Tanzania.
Inakuwa shida?
Hata, I mean, everything aside, Coke baridi. And I know there are people who have such, connections with their, habits. Like, kuna patients wanakwambia, daktari, hata hii nisikunywe hata kidogo bia moja mbili. How do you deal with that? Because, that's gonna be hard.
It's not easy because food is emotional. Nimekuja kurealize food is emotional. Kuna watu wameattach ngano na hapana doc. Na nakwambia tu live venye umesema, hii nayo siwachi. Namwambia okay sawa.
Niwache chapo
So we do it slowly by slowly, right? See, we've come up with a treatment plan and there are pointers we need to work on, right? So we do it slowly by slowly. We are like, there are people who have 100% mind shift. Nimekuja kusikia kwa watu wa military, unamwambia fanya hivi, anafuata. So there are people who you tell 10 things and they be following through with the 10 things. There are people you sit down, yes, they tell you, doc, mimi to be honest, first of all, job yangu tayari ni stress. Mimi nayo, na siwezi acha job yangu, nataka niache alafu. Namwambia ni sawa, mimi sijakwambia uache. We just need to work on, in that stressful environment, what tools can we use to help you manage that stress when you're in that job, without you leaving your job. You get? So kama inakuja ni food, we sit down and discuss. Okay, si umesema unashindwa na kuacha hiyo Coca-Cola for example. sawa bas, hiyo si hiyo tutaanza nayo. When you start removing the more difficult things, like zile vitu wewe unapenda sana, if we start by removing those things, it becomes more of a challenge. So tunaanza na hizi vitu ndogo ndogo huku chini. You get? Tutoe the smaller ones. And you're not just removing, you're removing and ensuring you don't leave somebody imbalanced. You're introducing something else. Si kuacha tu mtu, especially if for example they were eating, let's say you're removing them from things like meat. Yeah, and the reason because you're going plant-based, so because you want to reduce inflammation. There's a whole story. You want to reduce things, etc. Right? So you want to do that. So you make sure when you're bringing in the plant-based, the quantities, maybe you need to push them a bit higher. Because unaona kama nyama inakuanga na a bit more iron, vitamin, B vitamin. So kama una introduce hizi maharagwe na makamande na ndengu, una make sure watu wananiambianga hivyo chakula good healthy food is tasteless. That's what people tell me. Imagine it's not. It's how you cook it, and that's the other thing. People need to learn how to cook their foods just a bit differently. Your food doesn't have to be tasteless. Imagine. It doesn't have to be. But yes, tunafanya hivyo. Hata diet inaenda pole pole. It's stepwise. We don't rush you into it. And even ukiwa kwa consultation room, naeza unapima unaona venye mtu ana behave, how receptive they are, because that can also tell you
how they're going to respond.
Yes.
So in short, if somebody is not ready or not willing to go this very strict route, because I'm getting it's very restrictive.
No, it's not restrictive. It's not as restrictive as you think. Because mbona unasema ni restrictive? Mimi nimekuambia
umesema kwanza, okay, for example tunakata nyama.
That was an example. It depends with what condition you have, to be honest. It depends. Na hata ukikata
both carbs na nyama.
Hapana. Ukiacha hivyo utakuwa na hizo pia nutritional deficiencies. So you can't do that. Huwezi fanya hivyo.
Hautaniambia nikuwe vegetarian.
Ati hapana. Like I can't force you to do things. Because on the flip side, you also meet vegetarian patients. Yeah. You have to exactly. So you have to know where hiyo B12 utaitoa wapi ndio make sure anaikula na anabaki vegetarian. Because you see that is more cultural and other things. That's why I said integrative medicine is very holistic. You consider people. The way Somalis and Indians eat is very different. So lazima udeal na wao hivyo hivyo. It could be religious, it could be cultural, it could be financial. Unaambia mtu hapa aende akule unaambia mtu hapa aende akule kinwa hata ni nini? What is that? Exactly. So you have to deal with them. So if a patient, and I usually ask my patients, from a financial perspective, what is it that we are able to do or not? So if and I work with you at that level.
Okay. So you mainly deal with chronic disease.
Yes, to be honest, chronic disease prevention and management.
So our chronic diseases, tukona the lifestyle ones. So DM, HTN, is thyroid there?
Thyroid.
Hyper.
Both. Na kuna zile autoimmune, zile zenye hatujuangi solution ni nini? Hashimoto's. Autoimmune diseases.
Can also be managed.
Yes.
Lifestyle.
Yes.
Without medication.
Put a point. Doesn't have to be without medication. The thing is, unaweza kuwa ulikuja tayari ulikuwa on medication. So some people you find they can't fully go off the medication. When you try to withdraw the medication, you find their flare-ups a bit. So when you use maybe, kama alikuwa anatumia like 90 grams, maybe we've reduced it to 25.
So give me an example of somebody with because this one I am thinking there's no lifestyle solution. Somebody with hyperthyroidism.
Okay.
First diagnosed, not been studied on meds, but you see akona signs. Nywele imesimama, macho imeanza kudilate kidogo.
Yes.
Weight ndio inaenda kidogo. Hajui ni nini, but you do a test.
Unapata iko hivyo. So unaona kama sasa hiyo TSH imekuja inafanya ile kitu, right? Like it's just off. As I said, hizi vitu zingine ni emergency, right? Hiyo nayo itabidi deal nayo ama huyu patient ata tip over. So you deal with it.
So you have to start with
you start with the medicine. Yes, exactly. you start with the medical part because you can't, you know, that will be putting a patient death sentence. So you start with the medication, but in starting with the medication, you also advise them on which dietary changes should you make. Ile time you have time, just have a look at what things like dairy, gluten, how they impact, because they cause inflammation, right? How they impact thyroid hormones and all that. Na see, at dairy, like the kimaziwa, the casein inside the dairy, right? So when you switch to milk, unaweza kosa kunywa maziwa ya ng'ombe, ukunywe maziwa ya mbuzi. You get? It will have, the casein levels, or like casein A1 is iko chini kuliko ya ng'ombe. Na iko na casein A2. It's a bigger name than what I'm saying, but yes. Kama ya ngamia, iko better. But unaona sasa?
So these things are analyzed up to the molecular level in terms of the food. Yes. Same applies to deodorants, soaps. Yes.
So like deodorants and soaps, actually anytime you're buying something, anytime you're buying something to eat, put on your body. There's somebody who came up with a very strong statement. Akasema, kama uwezi kuleo kitu, like uwezi yaka kwa mdomo, usitumie. That statement has stuck with me in my head and I keep reanalyzing it. Over and over and over again. Just sit with it. Hata mimi nilisema, wacha kwanza nikae, hata ilito ni kipande. Uwezi, kula. So, kama hizo vitu roll on, anytime you're buying something, check what is contained in that ingredient. Umeinunua kitu, uwezi soma isoflurosylhexane 25. You're like, ini nini hata? Just check, yes. And I usually say this lifestyle and diet things are not as hard as we make it to be. For example, umeambiwa maybe you're incorporated. Unaona venye umeniuliza sasa turmeric ni ile kitu inakulanga. You can, these days there are balconies. You can grow your food on your balconies. And by that I mean like hizo herbs. So uliuliza kwani si chakula itaonja tu fua. Unakula maharagwe inaonja tu fua. Haijafanya kitunguu haijafanya ati ndio?
Aroma. So
you can use your herbs and spices. Herbs and spices and the natural side like oregano, basil, ni mingi, cinnamon, depending on what it is that you're preparing. Na unaweza zipanda tu hapo kwako kwa balcony. Unajua siku hizi kuna zile longitudinal hata acha hivyo. Sijui inaitwa nini, hata mimi najaribu kukumbuka. But those longitudinal things za kufarm. Na unaweka tu ingi kwako. You have a small space but you're producing your own stuff.
Isn't that life too hard?
Wait, what? Flip side, why do you think it is hard? Ebu imagine.
Mimi sinataka tu ningie pale Bolt Foods. KFC leo wako na offer, bana we click. Badala ya kukaa chini ujipikie. Kujipikia ni kazi mingi. Mimi nacheza tu PS yangu nasikia
food imeingia. Sasa fried foods umejaza kwa tumbo. Consistently eating that kind of food, hata just in the Western medicine, we are already saying that consistent eating of fried foods continuously. Alafu, isn't like I'm just thinking. Okay, we were talking about pill bathing, but also, isn't it easier to just take a pill a day? Because crazy, even if you're supposed to be on 5 medication. Kuna amloza 8 blah blah blah, kuna like 4 pills in one. Yes.
Isn't it easier me taking that one pill?
Na hizo pills si pia zinakuanga na side effects.
Then doing all these ni cinnamon inatoka.
How sasa una the medication that you're taking, doesn't it also have side effects? Does. Right?
That's why we try to wean patients off.
There you go. As you're also winning them, I think also as clinicians, let's think on this point of what if even not starting it in the beginning. Uko mashinani, mimi, I like going for medical camps, especially uko mashinani, ndio nisikie tu stories za patients. Napenda kusikiza patients sana. Because they tend to give you, and I usually say, unajua kama si patients ungekuwa daktari, ungekuwa unaona nani?
True.
Their voice is very important in what we do. And not just that what I do, what we all clinicians do. You find umekuwa ulienda huko, sukari ilikuwa hata daktari juice aliandika tu metformin na nini.
Yes. The protocol says to start with metformin.
Yes, you just start with metformin. sometimes kuna zile gut effects, maybe patient wako alikuwa na issues sijui nini. Yeah. So that's why I said look at your patient holistically then determine. But I also understand saa zingine huko mashinani saa zingine hakuna hizo dawa, like unafikiria maybe kwenda another but you can't because haiko. But yes.
So this is what you
do. Yes, that's what I do. And it's very fulfilling. Ash. You have no idea when a patient anakuja na anakuambia doc. Hata sehemu nyeti imeimprove.
Yes, all right. That's really amazing. So, as you wind up, your practice is called wellness. So this is called wellness medicine. Wellness what?
I like the way uko tuko. Anyway, I'm an integrative medicine specialist with a focus on functional medicine.
Functional.
Yes, where we deal with chronic disease prevention and management.
Okay.
Yes.
You have a private practice?
So we have, yes, we have a private practice. So we are called Kay's Wellness Center. KAY' Wellness Center.
Who's Kay?
Oh, where the name came from? That was an inspiration from my firstborn. Yes. When I told you, even with the gastritis, see, I got better. Just before I got pregnant with her, I had a flare-up. A really bad flare-up, a drip. So I went, when I got pregnant, like the whole time, nothing happened. And after her, I've not had, I honestly can't remember the last time, I was in a drip. Yes. So this was an inspiration from her because it made me desire to open up my own facility and actually help patients with chronic, mostly prevent them, but even though they have them, help them manage those diseases through diet and lifestyle. So it's named after her. Sijui ya watoto wangu wengine watasema nini, oya mami ukutupea ki.
I've seen families with very long
yes.
Oh, so Kay's, where is it?
So we have a clinic in 40 Suits, 40 Suits, 8th floor, room 809. The name you'll see there is called Mirazi Specialist, but niko hapo ndani. And then there's a new thing coming up for all my people wenye wako hizi pande za Kikuyu, Gikambura environments. Huko kwenyu, pole mdogo. Mtani finance, mgini finance. Kaende.
Huko atunanga pesa.
Wacha madoki kwanza, clinicians kwanza waanze kuview patients holistically. So kazi yangu itakuwa kufungua tu center, unaambia msi run huko. Yes.
Is there a training in Kenya?
For integrative medicine?
Is there any hope?
I think there is hope. And the reason I say so is because MKU and KU have departments. There is a department of traditional medicine where they are teaching under pharmacology, pharmacognosy, hizo vitu. Wanafundishwa hizi vitu. So yes, there is hope. Na unajua kwa MOH kuna department of traditional medicine. Do you know that? Yeah, okay. Hiko. Because you also need to regulate the practitioners. Na under the radar, doctors are doing these things. Watu wameanza ku practice. You know the way you're deciding, it's not just medicine. Let me upscale this thing. Let me look at my patients kidogo differently. So you're deciding you're doing integrative medicine and then you're upscaling it with something else.
Are there any other doctors that you know that have done integrative medicine? Okay, you mentioned your mentor.
Yes.
Dr.
Chanel.
Yeah.
Yes.
And now you.
There's me.
Is there any other?
There's
Ula kutuambia autophagy. Ula ananiambia starve your patients, shouldn't eat so that they get better.
Kuna wengine, there's another one in Nanyuki. She's called Dr. Carol. But ni wachache. And remember, unajua alternative medicine involves, it's not just functional medicine. Iko na acupuncture, iko na TCM. TCM is traditional Chinese medicine. Sijui nini. Mimi nime experience chiropractor. So yes. Na fascia manipulator. Lakini ya kuenda hiyo extreme. Unasikia ile kuvunjika hapana. But I've experienced a fascia manipulator plus with chiropractor. Na furthermore, si lazima awe daktari. Let me just say that. It could be a CEO, it could be a nurse, could be a physiotherapist, could be a doctor. Then you've done your specialties in those things.
Amazing. Any parting shot as we wind up? We've taken a lot of time. You can talk forever on this integrated medicine thing because it's amazing. Apart from telling people how quick the case.
Mimi si herbalist, so nilianza nikiitwa herbalist, nimeacha kuwa herbalist. Hadi wazazi wangu walikuwa wananiita herbalist. Kidogo kidogo sasa wananiambia hebu tuletee ile kitu ulitupea last time.
So you have them? You have those?
Yes, I have them. What I recommend, wherever you can get them from, because there are people already offering them. But my parting shot would be, as healthcare workers, we have a very big responsibility to look at our patients a bit more holistically and individualized. Because the day your relative will get sick with a chronic disease, or you as a person, is the day you stop that Coca-Cola.
I feel that.
Ngoja upate nini inaitwaje? Nini uric acid.
Hope not.
Let's hope not. Yeah.
Hope I'll enjoy my Coca-Cola till I'm 101. Babu yangu alivuta sigara paka 110.
Najaipatwa ni lung cancer.
Exactly.
Yeah.
So Daktari, thank you very much for gracing Daktari.
Awesome.
I feel we still have a lot to talk about from this thing, and this should just be a first of many.
All right.
Yeah.
Awesome.
I'm sure people are going to have many questions. Ask them so that next time Doc comes, we ask her. Right? So, kama kawaida, piga subscription, like, comment, share, and amfuate Daktari. She's online as well.
Everywhere. Jacqueline with a Q. JACQUELINE. Jacqueline. But otherwise, if you search K's Wellness Center, utaipata.
Amazing.
Yes.
Amazing. So from us at Daktari, quick one. See you.